all about Velcade, Bortezomib.
So Velcade, also called Bortezomib, is a proteasome inhibitor that's used in the treatment of multiple myeloma. It's one of the main classes of drugs that we use in the treatment of multiple myeloma. Velcade, or Bortezomib, is a first-generation proteasome inhibitor and is considered a reversible proteasome inhibitor.
In 2003, Velcade for IV administration was granted accelerated FDA approval. In 2012, Velcade for subcutaneous administration was granted FDA approval. How do proteasome inhibitors work?
Proteasome inhibitors work by inhibiting. Proteasomes are intracellular machinery that is intended to degrade intracellular proteins, basically to allow for the normal function of a cell to remove the proteins that are not desirable. That's important for maintaining a cell's integrity. And proteasome inhibitors work by preventing that. So there's an accumulation of junk products, and this ultimately leads to cell death. And this cell death in the case of multiple myeloma is what is desirable because we are intending to kill the myeloma cell.
To learn more about the class of anti-myeloma treatments known as proteasome inhibitors, make sure you watch the lesson on proteasome inhibitors in HealthTree University's Classes of Drugs course. What are the indications for Velcade?
Velcade, or Bortezomib, is used in the treatment of newly diagnosed multiple myeloma, as well as relapsed refractory multiple myeloma, and has been explored in numerous combinations. It continues to be a very frontline, favorable option, as well as option for later lines of therapy.
How is Velcade used as a combination therapy in newly diagnosed multiple myeloma?
Velcade has been a very favored agent for frontline newly diagnosed multiple myeloma for a number of years. In the triplets era, supported by the SWOG 0777 study, it was used in combination with lenalidomide, also known as Revlimid, with dexamethasone. And nowadays, the era of the quadruplets, it's used in different ways. With the Griffin or Perseus data, we've seen that Velcade has been used as a 4-drug combination with dexamethasone, daratumumab, and then lenalidomide, also called Revlimid. And then with recent data, just from earlier 2024, we've seen it used in combination with isatuximab, dexamethasone, lenalidomide, and Revlimid. And so it has continued to be a very potent staple for our frontline options.
How can Velcade be used in relapsed or refractory multiple myeloma?
Velcade has been used for different relapsed refractory scenarios, and it's been looked at in several different trials. In general, if someone is relapsed refractory with most recently having been on Velcade, it's not a favorable option. But if someone has not been on it before, or if there's been a great period of time since they had the original exposure, it's a reasonable combination to try. Some of the most notable are the combination of daratumumab, Velcade, and dexamethasone, and then there are others as well. The combination of selinexor, Velcade, and dexamethasone was supported by the Boston trial and is also a viable option for relapsed refractory multiple myeloma.
According to the National Comprehensive Cancer Network's treatment guidelines, the following combinations can be considered for the treatment of multiple myeloma. Velcade is used in the following combinations as initial therapy for patients who are candidates for transplant. Velcade is used in the following combinations as a maintenance therapy. Velcade is used in the following combinations as initial therapy for patients who are not candidates for transplant. Velcade is also used for patients with previously treated myeloma in the following combinations. How and where is Velcade administered?
Velcade is administered nowadays subcutaneously. It was originally studied as an intravenous drug and technically can be given that way, but it has a much higher rate of neuropathy and other side effects. And so the subcutaneous route of administration is really the preferable way for it to be given to patients. Typically, it's given in the stomach, so an area of the skin is pinched off around the abdomen, and that site is rotated to prevent local reactions from occurring and accumulating. It can also be given in the thigh if the abdomen is not preferred.
What is the FDA-approved dose and schedule? How is it dosed in the typical practice?
It's approved at a typical dose of 1.3 milligrams per meter squared of body surface area, and by most clinical trials has been supported for use twice weekly on days 1, 4, 8, 11, and so on. To be clear though, there are several clinical trials that have looked at different dosing schemes, and in the real world, this is adjusted even further. What we've seen with real world data, and there's been a movement for this with support, is to just use once weekly Velcade. That seems to reduce the incidence of side effects, including neuropathy, while still maintaining excellent efficacy.
Once weekly Velcade is administered on days 1, 8, 22, and 29 of each month with a 1-week break between days 8 and 22. How can the dose of Velcade be modified for patients who are frail?
In general, Velcade, like many other drugs, are adjusted for tolerability for the sake of the patient. And so if someone cannot tolerate the 1.3 milligrams per meter squared dosing, it can be reduced to 1.1 milligrams per meter squared, 1.0 milligrams per meter squared, all the way down to about 0.7 milligrams per meter squared. There is a paper that has been published several years ago with adjustment suggestions, but ultimately it's important to speak to your physician for that conversation, because they will adjust it based on your particular scenario needs.
Dr. Palumbo, a member of the International Myeloma Working Group, provides a helpful table for dose adjustments. Table 1 provides guidelines for the dose level to be used based on the patient's characteristics. If the patient has no risk factors, they will use dose level 0. Patients with one risk factor may adjust the dose to the level 1. Patients with more than one risk factor may consider starting at dose level 2. Table 2 describes the dose and schedule at each dose level. It is important to note that if you are on dialysis, your doctor will administer Velcade after the dialysis procedure. What are the main side effects of Velcade?
The most famous side effect that's associated with Velcade use is neuropathy. And that's a tingling or numbness that occurs typically in the toes first and can extend upwards from the leg and be in also the fingertips. And it's something that most prescribers will ask about pretty much at every visit. Is someone having pain or numbness in their feet? Are they having trouble buttoning buttons? That is the most prominent side effect that we worry about. If someone does start to experience neuropathy, we often talk about dose reduction, dose interruption, and then there are other options to management as well, such as gabapentin or pregabalin or duloxetine. And if the neuropathy becomes something that is more prominent, something that is of higher grade, as we would say, then sometimes it needs to be stopped altogether and not pursued again. Other associated side effects with Velcade use include fatigue, diarrhea, low blood counts, rarely alterations to kidney and liver function. And all of those are things that a patient's physician would be looking for, watching for, and monitoring. It can also cause styes in a select number of patients. Somewhere around 5 to 10% of patients can get a stye or chalazion along the eye. And if that occurs, we will often refer to ophthalmology at an abundance of caution, but typically warm compresses and then sometimes dose reduction and dose interruption will help resolve that for patients.
Additionally, suggestions for managing fatigue and other side effects discussed in this video can be found in the Find Side Effects Solutions tool of HealthTree to your hub. Search on a specific side effect to find solutions that others have found helpful. These solutions have been provided by patients just like you. You can also filter side effects by an individual drug or combination of drugs. When filtering on a combination of drugs, keep in mind it might not always be clear which drug is creating which side effects. What are injection site reactions and how can they be managed?
Velcade very often causes local site reactions, and this is exactly what it sounds like, where the area of the skin that had the Velcade injected it into will become red, puffy, and irritated. That will usually go away on its own after the dose has sort of resolved. But then obviously when there's a re-administration, it can happen again. This is one of the reasons why we rotate the sites of administration, often in like a clockwise or anti-clockwise fashion across the abdomen. For more prominent site reactions, sometimes we do local creams such as an antihistamine orally or topically, or an oral or topical steroid as well. Ultimately, time really resolves them.
What is the air sandwich technique?
The bubble sandwich with Velcade, it refers to kind of a trick by nursing that they will allow a little bit of air into the syringe, then the drug, and then a little bit more air, to where then when it is actually administered to the patient, it softens the impact of that and helps diffuse a little bit of the injection. So where it might be very concentrated to a little bit less concentrated, that increases the tolerability locally for the Velcade. Typically, Velcade is given over a course of a couple of minutes, but by experience, the bubble sandwich is more beneficial than the speed per se.
Serious side effects that have been reported with Velcade include heart problems, lung disorders, liver damage, tumor lysis syndrome, posterior reversible encephalopathy syndrome. If you are taking Velcade in combination with other anti-myeloma agents, you may experience different side effects. Let your doctor know if you are taking medication for diabetes, as Velcade can affect your blood glucose levels. Your doctor may ask you to closely monitor your blood glucose levels and may adjust the dose of your diabetes medicine while you are being treated with Velcade. What prophylactic medication should be prescribed when taking Velcade? Why are these prescribed, and what is the dose?
One medication that we prescribe almost universally is acyclovir, and we do that for shingles prophylaxis, i.e. to prevent shingles. It also more broadly helps other infections caused by herpes viridae viruses. The typical dose for that is 400 milligrams given twice daily, but I should note that that is adjusted based on a patient's kidney function, and so it could be actually much lower than that standard dose.
Why would someone on Velcade be more prone to shingles?
In general, with a lot of these drugs that affect people's immune systems in any sort of way, it allows the emergence of shingles to occur, or herpes zoster. And so in giving a preventive medication, we've been able to show that it has reduced incidence.
If someone gets a shingles vaccine, will they still need prophylactic medications for Velcade?
In general, we do recommend that people receive the shingles vaccinations, Shingrix and Zostavax. But typically, if they are still able to take acyclovir and are willing to do so, we still recommend that they do so as well, because even apart from the specific shingles efficacy, there are other herpes viridae viruses that are treated by that.
Are there any premedications you need to take before a Velcade injection?
While not absolutely necessary, typically when people start, they will be given Tylenol and Benadryl, and that can be peeled off as people's tolerance increases to the medication.
What is the difference between Velcade and Bortezomib?
Velcade and Bortezomib are the same drug. The brand name was Velcade, the generic name was Bortezomib, and originally we only had that brand name, but we also now have a generic Bortezomib as well. So we will use these names interchangeably. In general, with most regimens, patients will see the V there, so Dara VD, referring to the Velcade, but again, the generic name is Bortezomib, it's the same. With one regimen, we'll see the Bor in it, and that's Cybor D, but in all the other ones, wherever there's a V seen, it's a good bet that that's Velcade that's being discussed. Velcade is an excellent drug overall. It is tried and true for multiple myeloma, continues to be a staple for myeloma care.